Good morning, everyone. Welcome. We'll begin in just a few seconds as we let those coming in have a moment to connect to their audio. Great. Good morning, all. Welcome to today's San Francisco Interfaith Council's weekly online briefing for faith leaders. Today's topic, preparing for seasonal hazards of extreme heat and wildfire smoke. This session is hosted by the San Francisco Interfaith Council and supported by the Joint Information Center of the San Francisco COVID Command Center. Some housekeeping for today. Audio, video, and chat will be monitored and recorded for record keeping, training, and quality assurance. By default, all participants will be muted and video turned off to minimize distractions. For chat, to submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. They will be shared with the speakers and panelists after the meeting for response. Thank you. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continued preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book appointments if available. Now is the time to come together, San Francisco. We've been through so much in the last year. Together, we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, please contact the San Francisco Police Department at 415-553-1133. And a special note that the San Francisco Interfaith Council is a sponsor of this program. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Elisa, and thank you to the incredible team at the COVID Command Center's Joint Information Center Virtual Outreach Team. Today is a momentous day in the history of this series and programming, as it is the last program we will produce together with the City and County of San Francisco. The success of this program has attracted funding from the Meta Fund, which will underwrite future programs beginning next week. So we will have a seamless transition, but we are indebted to the COVID Command Center's Joint Information Center Virtual Outreach Team for providing this platform and the incredible staff that has enabled us to offer this programming, which has allowed San Francisco faith leaders to be able to make informed decisions on behalf of the safety, health, and welfare of those entrusted to their care. Good morning, I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for faith leaders. As San Francisco eases COVID-19 precautions, looming on the horizon are other disasters that will demand attention. Climate change-related extreme heat events and wildfire smoke events are increasing in both frequency and intensity. And these events have serious health impacts, especially for the same communities that already suffer the greatest health burden. In this week's online briefing for faith leaders, hosted by the San Francisco Interfaith Council and supported by the COVID Command Center's Joint Information Center Virtual Outreach Team, the San Francisco Department of Public Health, Department of Emergency Management, and Office of Resilience and Capital Planning will provide background on San Francisco extreme heat and wildfire smoke events, identify actions you can take to prepare for and respond to extreme heat and wildfire smoke this summer, and outline a new initiative to implement medium to long-term strategies in order that the city may be more resilient to these events in the years to come. At this time, it is a great privilege and honor to welcome the founder of the San Francisco Interfaith Council and the matriarch of Interfaith in San Francisco, the wonderful Rita Semmel, who will lead us in a welcome on behalf of the council, as well as read the opening interfaith statement. Rita, the floor is yours.
Good morning. Thank you very much, and welcome to all of you. It's a pleasure to be with you on this morning. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this meeting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. Welcome, everybody.
Thank you, Rita. At this time, I want to welcome Reverend Vanessa Rush Southern, the Senior Minister of the First Unitarian Universalist Society of San Francisco. Vanessa, in addition to her pastoral responsibilities at the First Unitarian Universalist Society, is also a member of the Board of Directors of the San Francisco Interfaith Council, and has really, throughout the pandemic, been an active participant on a roundtable of faith leaders that has been meeting weekly. Vanessa, we welcome you, and we ask you to lead us and ground us in a reflective moment.
Of course. It's wonderful to be with you all in this flurry of reopening, which I think has us all very busy figuring out what it means, and also very busy dealing with what it means for us emotionally. I wanted to ground us as we start this program, as we have in all our programs, with a time of prayer and meditation. So please join me. Spirit of resilient earth and fragile balance. Spirit of seasons and storms, of winter loss and fallow regathering. Spirit of resplendent life reborn in spring, in color and fragrance all around us. In this spirit, we gather as people in a time of complicated reopening and ongoing reckoning. In a time when past and present, absent accountable relations to the very elements of earth on which we rely, is bending back upon us in glacier melt, in fire and rising tides, in fierce and unpredictable storms. In preparation for life in relationship to these changes and life in response to them, hoping for both luck and grace, we leaders, lay and ordained, and secular and religious, are called to reframe who we are, to prioritize future generations in our relationship to the natural world, and accountable to avoid the Armageddon we increasingly sense that we are close to handing on to them and to all life to endure. So in this short and long-term spirit of reflection and reckoning, we gather. Spirit of life and love, you wellspring of courage and miracle, spirit that calls into the world from time to time that mighty confluence of ingenuity and stubborn persistence for a dream. Help us to light the fire within each of us to turn back the tides and turn ash to meadow and replace orange skies with fields of California poppies. Bless this time and the work it calls us to. In the name of all we each know and claim as holy. Amen.
Amen. Thank you so much, Vanessa. The programming for these briefings happens well in advance, and we never know what the course of events will take us to be at that moment. But I think I'm one of the few people who still reads the print edition of the San Francisco Chronicle, and this is what today's front page had to say. So I think we are on the same page, and today's program couldn't be more timely. Both extreme heat events as well as wildfire smoke have been events that the San Francisco Interfaith Council has been involved in responding to in the past. We have worked very closely with the Department of Public Health in getting out not only their messaging, but also identifying facilities owned by religious institutions to be cooling stations, so that those who are not able to have respite will be able to have respite. And also, I think with the North Bay fires, not only did we help respond locally, but we also, with our colleagues in our neighboring counties, played a very important role in working with the San Francisco Department of Emergency Management, the Salvation Army, and the Red Cross in creating these relationships, as well as providing chaplaincy for those who were traumatized and evicted from their homes at that point. Today, we are very pleased to have with us Adrian Bocelli, the Deputy Director of the San Francisco Department of Emergency Management, Alex Morrison, the Resilience GIS Analyst for the Office of Resilience and Capital Planning and co-manager of the Heat and Air Quality Resilience Project, and Tiffany Rivera, Deputy Director of Public Health Emergency Preparedness and Response Branch of the San Francisco Department of Public Health. For the next 20 to 30 minutes, they will share with you some very important information. I hope you're taking careful notes, but we also remind you that these programs are being recorded, and we encourage you to share them with your faith communities following this programming. So Adrian, Alex, and Tiffany, the floor is yours.
Thank you very much, Director Pappas, and good morning to everyone here. Thank you for having us. As Michael mentioned, my name is Adrian Bocelli. Excuse me, I'm the Deputy Director for the San Francisco Department of Emergency Management. I oversee emergency services for San Francisco, which includes our city's Emergency Operations Center, or EOC, as many folks know. With me here, as Director Pappas mentioned, is Tiffany Rivera, Deputy Director of the Public Health Emergency Preparedness and Response Team for the Department of Public Health, and Alex Morrison, a Resilience GIS Analyst and co-manager of San Francisco's Heat and Air Quality Resilience Project from the Office of Resiliency and Capital Planning. You'll be hearing from all three of us today. What we will do is we will introduce some impacts from extreme heat and air quality events specific to San Francisco. We will also provide some information on how to prepare for those types of events and hazards locally. And we'll also introduce this thing we call the HAQR, the Heat and Air Quality Resilience Project. And we're planning to talk through some of our short-term as well as our medium and long-term planning and response operations to these types of events. So we'll go next slide, please. We'll start by introducing some of these known hazards. People know what extreme heat and poor air quality are, but we'll talk a little bit about what makes them particularly difficult in a place like San Francisco. So we'll go next slide, please. So heat is a big deal here. As Director Pappas just showed us the front page of the Chronicle, we're in it right now. Many people from outside the area or people who are not San Francisco natives laugh when they find out that the city defines an extreme heat event starting at 85 degrees in San Francisco. But this is actually due to a lot of factors, which I'll get into in a future slide. And we're right on the border of one of those events today. We're forecast to reach the mid 80s shortly before noon today in the downtown area of San Francisco. Though we know our wide array of microclimates really make the range pretty broad throughout the city, likely from the high 70s to the low 90s just today, all within the 7x7 square that is San Francisco. But let me give you an example that's shown here on this slide. Many of us will remember the Labor Day weekend heat wave of 2017. This is particularly, not quite yet, Alex. This is particularly reminiscent for members of the Department of Emergency Management who responded somewhat poorly to the incident because at that time we did not yet have a robust and well-practiced extreme heat plan. So as you can see with this graphic, it was hot in 2017. On Friday, September 1st, the temperature hit 106 degrees, which was the highest temperature ever recorded in San Francisco. And then the next day, on Saturday, the temperature hit 100 degrees. And that's only the second time ever recorded in history that it was over 100 degrees 2 days in a row in San Francisco. And this heat wave here during that Labor Day weekend represented really the perfect storm of events, a really, really intense heat wave, a holiday weekend where a fair amount of city staff, including emergency medical staff, but also emergency managers were out of town for the holiday. But most importantly and most significantly, temperatures were way higher than forecasted. Projections from the National Weather Service had said, upper 80s to mid 90s, and they far exceeded 100 degrees, which ended up being a huge deal. So now next slide, Alex. And so here's what happened. This is a graph of our 911 medical call volume over that weekend. This was the first time we saw an incredibly significant jump in EMS calls that were directly tied to an extreme heat event like this. And it really clearly noted the health impacts of extreme heat. We saw a 48% increase in EMS medical calls for service compared to previous years. And we actually had to request mutual aid from neighboring counties to help us with these medical calls. We also saw a 17% increase in emergency department visits over this Labor Day weekend compared to previous years. This comes out to an increase of almost 79 visits per day over this 3-day weekend. And notably, we saw a 34% increase in emergency room visits for children under the age of 4. And we saw a 39% increase of our senior population over the age of 65. So while we saw an overall 17% increase total, the most vulnerable were much higher. Next slide, please. And so really, why is San Francisco so vulnerable to heat and to poor air quality? Well, we live in an urban heat island. And what that means is it's basically an urban area or a metropolitan area that is significantly warmer than its surrounding rural areas due to human activity. And so the map you see on the right in this graphic, that's kind of the green, orange, and yellow, is a surface temperature map from this 2017 Labor Day weekend heat wave. And you can see the areas with a greater concentration of asphalt or black roofs or other surfaces like that have higher surface temperatures. And you can see that it's really concentrated in the eastern and even the southeastern portion of the city. And so this urban heat environment really contributes to San Francisco's vulnerability. We're also just not physically used to this. As a native San Franciscan, I often joke that my happy place is somewhere between 65 degrees and like 73 degrees. And anything below that, I'm frozen. And anything above that, I'm basically miserable. And while I'm exaggerating a little, there's a lot of truth to that. And many people like me are so passionate and dedicated and proud to be born and raised here, that if we are fortunate enough to be able to stay, we stay forever and we raise our families here and we all get used to this temperate climate. And our bodies are just simply not used to things like seasons or major temperature fluctuations. And then it's our infrastructure. Our infrastructure in San Francisco is frankly just not built for major temperature changes and especially heat. Our buildings are not insulated very well, whether it's in old school San Francisco home or windows, and I'm getting a little bit of echo, thank you very much, or our lack of heating or cooling infrastructure within either homes or businesses. We're just not physically built to require this type of indoor temperature regulation. And unfortunately, this includes city buildings, things even within our healthcare system or our emergency response buildings, like our hospitals or our clinics or our fire stations. And you can see here on this bottom graphic that the red line notes the temperature levels across a point in time in 2018 within a room at a single room occupancy hotel, where the black line shows the actual outdoor temperatures. So you can see it can be way hotter inside and for way longer, frankly, than the temperatures actually reflect outside. So our buildings are not built for this type of heat. We also have very limited cooling capacity. We have the lowest rate of air conditioning ownership in the country, and that AC ownership is not equitably distributed, in that the areas with the highest concentration of hot temperatures do not match the data where people have been able to actually invest in these types of cooling systems. And the last thing I wanted to mention about heat on this slide is that it's not exactly listed here, but you can kind of see in that bottom graphic, once it cools down from a heat event outside, we still have 1 or 2 days of elevated risk for our populations, especially our vulnerable populations, because of our poor indoor insulation. Homes take a while to adequately cool down. And so if the temperature breaks outside, it does not necessarily mean that the worst is over. And so last slide here, Alex, please. Briefly, just a little bit on air quality. I spent more time talking about heat because quite honestly, the data shows that it's more deadly than smoke in San Francisco, even though it's not quite as visible, which can be a little misleading. But poor air quality is also a definite risk in San Francisco. And many of us remember September 9th of last year, what I call the day the sun didn't come out in San Francisco and everything stayed orange all day, as we heard in our reflection. Loved the reference to changing that to California poppies. But we've had several years in a row of poor air quality, often caused by wildfires along the West Coast, burning in either neighboring jurisdictions or sometimes far away jurisdictions where the wind patterns just bring the smoke to San Francisco and it gets stuck, and it can just sit there for several days until the winds finally blow it away again. And so this graphic here is from 2018. During the Camp Fire, which was the fire that burned down the town of Paradise. And because of the winds in 2018, we had 12 straight days of where our air quality index was over 150, which is in just the straight up unhealthy range. And our peak was at 228 was our air quality index. And And so that can really be difficult for people, especially vulnerable populations that have pre-existing conditions, which we'll hear a little bit about from Tiffany. So now that I've done the doom and gloom and stage setting, we can go to the next slide. You'll hear from Tiffany, who will talk more about what we can do about these hazards.
Thank you, Adrian. Good morning, everyone. So yeah, now that we have all this background, what can we do to stay safe during these events? Next slide, please, Alex. So I wanted to start by talking a little bit about what makes a person resilient to extreme heat and poor air quality. While everyone is impacted by the health impacts of climate change, these health impacts, again, are not distributed evenly, as was mentioned before. The communities that suffer the most are the ones who already carry the heaviest health burdens, and it would be very similar to those that carried the highest burden for COVID disease and death. We refer to this inequality as the climate gap. Facts that contribute to disproportionate impacts are specifically exposure, sensitivity, and adaptive capacity, which I will dive into a little bit deeper in just a minute. But what we do want to mention is that implementation of resources from our perspective should be targeted to correspond with the communities that suffer the greatest impacts. So in terms of exposure as a contributor, this is the degree that an individual interacts with the hazard. One of the biggest contributors is the home you live or your shelter. Is it weatherized? Does it stay cool when the temperatures outside increase? Does the air inside stay clean when the air quality goes down? Your physical neighborhood is another contributor. As Adrian mentioned, is it within an urban heat island with a lot of concrete and black roofs that can absorb heat? Are there large buildings nearby that are blocking wind? Does it have shade? Is there open space with other green infrastructure? What kind of stores and services are in the neighborhood? Do you have access to cool spaces nearby, like community centers, libraries, museums, that kind of thing? Another contributor is sensitivity. So pre-existing physical conditions that make you more sensitive to these hazards. So age, pre-existing health conditions like asthma, certain medications can put you at higher risk. There are some medications that affect your thermoregulation. So those are all kind of parts of the sensitivity contributor. What services do you have access to? Do you have quick access to healthcare, to behavioral healthcare, to social services, food, medicine, transportation? Do you have quick access to these sites that you can that you have nearby so you can shelter safely at home? Or do you need to travel far to go out to get food or to get medicine, which then increases your exposure? An adaptive capacity. Does your community have the political, social, or economic resources to prepare for or respond to these hazards? More importantly, what is your community like? Do you know your neighbors? Do you have people to check in on you during extreme weather events or during poor air quality days? Is there someone who's going to notice if something is wrong? So having control over these issues, over these contributors are what make communities more resilient against these climate change events. Next slide, please. So I'm going to pivot to discuss the health impacts and responding to these extreme heat events. So these are kind of things that you can look out for today. One of the more severe health impacts of an extreme heat event would be hyperthermia. This is, again, very severe cases that can lead to brain damage or even death. And the most fragile are at the highest risk for this. And as Adrian mentioned, the children and the elderly, as was noted by the increase in emergency room visits. It's also very dangerous in those that, again, are on thermoregulating medications or psychiatric medications, those people who are experiencing homelessness, or those who use opiates. Dehydration is another big health impact that can lead to different things. It can lead to fainting, as we heard earlier, which can lead to head injuries, broken bones, other larger injuries. Can also lead to electrolyte changes that can then lead to cardiac events. So what can we do to identify these heat-related illnesses? One thing to note is that heat has cognitive impacts on people, and so this could make it people less able to assess these symptoms in themselves, which makes it even more difficult. So it's important that we know these symptoms so that we can identify them in someone else when we see them. So heat exhaustion, if you look at the infographic on the right, I hope you can see it. I know it's a little blurry. Heat exhaustion is the less severe of these heat illnesses. Someone might feel faint or dizzy, excessive sweating with cool, clammy skin. They might have nausea or vomiting, rapid pulse, muscle cramps. The best things to do for these symptoms are to drink water, go to an air-conditioned place. There may be some cooling centers during these heat events, which you can, if we have cooling centers available, you can find them on the sf72.org website that is run by the Department of Emergency Management. Trying to keep your places cool before the heat event actually happens is probably the best thing to do. So making sure that windows curtains are drawn, making sure that you try to keep your indoor spaces as cool as possible before. If there, another thing that can help out are cool showers or cold compresses. And if drinking water, obviously, but sometimes there are some issues that can come with different medications. And so if you think that there's going to be some issues around the medications that you're taking, we just want to make sure that you call your clinician and seek advice from them. In terms of heat stroke, this is, again, much more severe. Some of the symptoms you may see are a throbbing headache. At this point, no sweating because you're so dehydrated that you don't have sufficient fluid in you to actually sweat. So skin will be like red and dry. You will see increased body temperatures, sometimes as high or higher than 103 degrees Fahrenheit. And some people may lose consciousness. So if we see any of these symptoms, the best thing, easiest thing to do is to call 911. And just to note, if you do see someone that is unconscious and it seems to be from an extreme heat event, to not try to give them water because they won't be able to, it can just lead to a choking event. So one thing to keep in mind. Next slide, Alex. Okay, so the health impacts of poor air quality are less severe than heat, as you can see by the information Adrian presented. The impacts of poor air quality is more of a long-term, they're more long-term in nature, so constant exposure to poor air quality can lead to more chronic respiratory issues. Some less severe symptoms that you may see during an air quality event are things like coughing, stinging eyes, a scratchy throat, runny nose, headaches. And some more of the severe symptoms that you might see are asthma attacks, severe shortness of breath, dizziness, and chest pains or heart palpitations. So the best thing to do to treat these symptoms are to stay inside, almost like sheltering in place. So I know it'd be difficult to kind of go back to doing that after we reopened yesterday, but it is the safest thing to do is to stay inside. One thing that we do ask that you take into consideration is a heat event. So if we are in a combined heat and air quality event, which has happened, we want to make sure that people focus on mitigating the effects of the heat as opposed to the effects of the air quality, again, because heat is deadlier. For mild symptom relief of these symptoms, you can talk to your physician about what over-the-counter medications you can take if you aren't able to stay indoors, or if your air quality in your house is poor and you're still feeling those symptoms, even though you are indoors. Make sure to have medications well stocked throughout the year, especially respiratory medications, so that you're not kind of desperately looking for or having to go outside to pick up a new prescription. Having your medications well stocked is good for any emergency, but for this kind of situation will decrease your exposure to the smoke. If you see severe shortness of breath or someone who is having chest pain or palpitations, the best thing to do is to call 911. Some of the things that you can do to some other things you can do to help out with the situation is to avoid activities that cause indoor air pollution. So things like frying foods, candles, vacuuming, smoking indoors. These are things that while we're having poor air quality events, it's best to kind of decrease these indoor behaviors in order to keep the air inside cleaner. There is information via the EPA on how to develop a clean air room. And essentially what it is if you have access to a air filtration system, a portable one, bringing it into a room, closing the windows and the doors and just keeping that room cool and the air cleaner there. And I will provide that link via, and I guess I don't know if the chat is available, but I will get that link to the JIC so they can provide that out with the video. And then one thing that is often a little controversial is the use of masks. around air quality events. So do have to explain, now that we are so commonly used to utilizing masks, that regular face masks, like what we are wearing, we've gotten used to wearing during COVID, are not effective at protecting against particulate matter, which is the matter that the smoke is, the smoke in the air. So it's not going to protect you or your lungs from that. If you, again, the thing that we ask is that people stay indoors as much as they can. And if you have to go outside for any reason, that it's safer to wear an N95 mask as long as it's worn properly, and that there's no facial hair, that kind of thing. But the thing that we are concerned about N95s is that they do tend to make some symptoms worse in people who have cardiac and respiratory issues. And so it's very important that if you feel that N95 mask is not helping, that it's making you work harder to breathe, or you're starting to feel other symptoms, that you do not utilize those N95 masks. And I will turn it back over to Adrian so that we can discuss some city response.
Thanks, Tiffany. So yeah, definitely what we do in the city to respond to some of these types of events is really important. And we have some key operations that I'd like to share with you. We, of course, are always tracking and monitoring our weather forecasts, but we also buffer them. And what I mean by that is making sure that we build in a buffer and we build in a range of additional temperatures that we could see. We monitor the forecasts, but as we saw during the 2017 Labor Day heat wave, and pretty much every other time there's any kind of heat forecasts in San Francisco, the predictions can be wrong. So we buffer those forecasts and operate on a range of temperatures and assume also key differences depending on what location throughout San Francisco that we're looking at. We are also responsible for public messaging and distributing information both prior to, as well as during and after a heat or poor air quality event. One of the hardest things that we've touched on already a couple of times today for people to wrap their heads around, because it's so contrary to kind of what we see and feel and smell, is protecting yourself against heat in the short term is more important than protecting yourself against smoke. And so as Tiffany mentioned, we're not saying don't stay indoors when it's smoky, but what we are saying is that if your home is 100 degrees and it's also unhealthy air outside, it's better for your health to go outside into the smoke to cool down a little, or even to open a window, than to stay inside in a stuffy or too hot environment and remain protected from the air quality. We also talk about things in our public messaging like window safety. We have an increase in accidents, especially with kids falling out of windows during heat events, where people think that their window screens will protect them when the windows are open. And so we do messaging around that, as well as beach hazards and accidents, because when it's hot, people flock to the beach to get respite, and they're usually unfamiliar with our sneaker waves and our rip tides that we see, especially along Ocean Beach, related to San Francisco. So we do a lot of public information during extreme heat and other weather events. But some of our key parts of our overall city's operational response to extreme heat and air quality include a multi-pronged strategy of opening what we call weather relief centers, highlighting other areas or ways to keep cool, and conducting various outreach to our most vulnerable populations. Our weather relief centers are locations throughout the city that are strategically placed, that are equipped with either cooling or air filtration equipment, and can be temporary places of respite for those who cannot find it at home or do not have a home. We also work with other city agencies like Muni or Recreation and Park to provide free admission, sometimes to pools, or free Muni rides, so that people are not exerting themselves and walking from place to place, and instead they can travel on an air-conditioned bus and without the burden of payment. And sometimes we're also able to work with our private sector partners, like museums or the Academy of Science, to offer free or discounted admission into indoor spaces that are cooled or have proper air filtration. And lastly, we activate additional outreach measures for vulnerable populations and residents that range from handing out extra water at homeless encampments to conducting, in-person or telephone wellness checks to seniors or others that are homebound. So that's just a quick recap of our city response protocols, and I'll kick it over to Alex to talk us through our heat and air quality planning.
Yeah, now that we've heard that great overview of some of the more immediate and great work that the city's doing currently for this coming season, I wanted to pivot a little bit and talk about kind of how the city is approaching addressing heat and air quality in the kind of medium to long term. So as we know, climate change is getting more intense, and these wildfire events and heat events are becoming more and more frequent. And so that represents kind of an urgent problem for the city. And there's been a lot of momentum in recent years to develop new heat and air quality resilience strategies, except that many of these strategies have either not been fully implemented yet, or they face challenges scaling up in how effective they need to be, because there hasn't been additional support for interdepartmental coordination and community engagement. And so this is really important because heat and air quality kind of represents a unique challenge for coordination for a couple reasons that we've touched on a bit, but the first of which is that it represents both an infrastructure impact as well as a more people-focused, social-based impact from these events. The second reason is that it often requires deep interdepartmental coordination between groups that don't normally have as large of a role in these longer term conversations around climate resilience. Think, like DPH, DOS, like these kind of more socially focused organizations and city agencies. The third reason is that a lot of these impacts from heat and air quality are much more tied to upstream social determinants of health, such as income and housing and all of these other things. So in a sentence, we think of the Heat and Air Quality Resilience Project as an initiative to increase the city's resilience to extreme heat and wildfire smoke through dedicated coordination, communication, and capacity building, so that we can support the city's work on short-term emergency response activities with more medium to long-term resilience and adaptation strategies. So just to riff off of what Tiffany kind of introduced earlier, there's a lot of things that make a person resilient to extreme heat and air quality, but increasing San Francisco's resilience kind of mandates a collective action from a lot of different city departments and community organizations that operate anywhere on this like broad spectrum of extreme heat and wildfire resilience. So these include people who plan and execute emergency preparedness and response activities, people who are responsible for building, regulating, or maintaining housing or other important community facilities. This includes getting input and interaction from people who represent, engage, or work most closely with communities that are vulnerable to these impacts. And finally, this includes a lot of those who provide direct healthcare or community services, as well as those who plan, manage, and create new open space and infrastructure in our other public work operations as a city. So unfortunately, when they were creating how cities operate, they didn't have climate change in mind. And so there can be a lot of unintentional barriers to kind of collaboration and shared resourcing that we really need to be able to address these emerging issues in the city. And so to address this, we kind of developed this project with the following goals that we think get at some of these. So as a general goal, the HAQR looks to increase the resilience of our frontline communities to the health impacts of extreme heat and air quality first and foremost. And we plan to do that through creating a shared space for city, community, regional, and academic stakeholders to come together to collaborate on current and future initiatives. We view this space as being the first step towards coordinating these medium to long-term strategies that we've been talking about. And we want to make sure that these strategies are benefiting communities with the greatest health burden, first and foremost, because we know that heat and air quality does have a specific population that it impacts most significantly. And the kind of three ways that we intend to do this is by working to increase funding, working to support research and evaluation so that we can be really smart about how the city is managing and investing its time and efforts. And we also want to make sure that we're increasing community involvement by increasing the number of opportunities for people to engage with the project and hear from us about what this project actually entails. So this effort really does start from carrying forward a lot of the great work that's already been done in the city. And we wanted to highlight kind of three things that are in that realm. This includes the Executive Directive 1804, which the mayor signed on, and this directive focused on improving San Francisco's response to future air quality incidents. The second thing we really wanted to highlight that this project builds off of is the Hazards to Climate Resilience Plan. And this effort served as the first climate adaptation plan for the city of San Francisco, and the Interfaith Council was a partner in that work, and we greatly appreciated that support. And the last thing we wanted to highlight is that this work also has intersections with the Climate Action Plan that's currently ongoing in Department of the Environment, and there are many aspects of that effort that touch on heat and air quality, such as weatherizing buildings, building electrification, things like that. So each of these actions seen here have really set precedents and form the starting points for the work on this issue. And part of the reason why HAQR's objectives are what they are is because we felt that we needed to create a space that can facilitate this work more effectively while serving as a dedicated space for these emergent issues. So just to give a more specific example, many of the strategies around heat and air quality that were in the Hazards and Climate Resilience Plan have been directly rolled into this effort, and this is kind of the vehicle to carry much of that work forward. So I wanted to get a little bit more kind of high level of where these objectives at the broad level can actually be represented in kind of work streams or things that are in the purview of this project. So for the existing buildings, we focus on this project in supporting existing weatherization and retrofit programs by identifying and addressing barriers for weatherization in public and private facilities. And in keeping with that theme of targeting resources where they're kind of most needed first, we want to focus on those buildings that are serving vulnerable populations. Think our like SROs, our supportive housing, our senior housing, multifamily housing, things like that. Another thing that's kind of in the purview of this project to be working on the medium to long term is supporting a lot of the city's community-facing resilience programs that build community capacity to prepare for and respond to these events. And so that looks like supporting the outreach, supporting effective engagement with community partners, helping to develop training and support the departments that are already doing a great work of developing training, but supporting them and getting that training to a wider audience. And supporting a lot of the social cohesion initiatives that the city is carrying forward. In the emergency response realm, we're looking to support emergency response and healthcare services to these events by supporting development of an equitable and interdepartmental respite center strategy, scaling our healthcare services so that they are responsive to these surges that Adrian was talking about, the way that these events can lead to a surge. We want to be helping support the planning of that surge so that it can meet the events as they come, as well as investigating other emergency preparedness response strategies that are further out and more long-term in addition to our respite center strategy. On the green infrastructure side, Adrian was mentioning this aspect of urban heat islands. So we want to be looking at the ways that we can support the installation and scaling up of trees, open space, increased natural areas, changing our pavement materials so that they're lighter colored and don't retain as much heat. So we want to be supporting those efforts because we know that they can help reduce temperatures and improve our air quality as a city. So now that we've kind of had this high level picture of what the project is going to be working on, I wanted to drill down into two specific examples from our current things that we're currently doing right now. So the first thing I wanted to talk about is the Heat Watch campaign grant that we applied for and received from the National Oceanic and Atmospheric Administration, also known as NOAA. So we applied for this grant in partnership with the Department of the Environment and the Neighborhood Empowerment Network within the city, as well as a few community-based organizations, notably Brightline Defense Project and NICOS. And this citizen science campaign involves recruiting volunteers to drive around the city on the hottest day of the year in order to collect data to be able to create a detailed map of where heat islands are concentrated in the city. And so you'll see an example of this map on the left. And so this is the type of map that would be produced for the city and county of San Francisco. This particular example is from Portland. But we're hoping that by getting this data, we can use that as a baseline data set to be able to track where interventions should be targeted, as well as how effective they are over time. So you can get this as a baseline. As we do different interventions, we could see how effective they are in actually bringing down the heat islands that we previously identified. So on the right, we wanted to highlight some of the work that we are doing with the Department of Emergency Management, as well as other departments, to support the ongoing efforts to standardize the activation of these public respite facilities or weather relief centers. So that across the city, these can be brought online in a more standardized and operationalized manner. So our role in this so far as like the HAQR has mainly been supporting collaboration between the necessary departments. So we've been focusing on the immediate needs for this coming season, but in the future, we're hoping to expand that effort to support broader emergency response interventions for extreme heat and air quality, in addition to these facilities. So now that I've kind of given that overview and a little bit of a more direct thing, I wanted to hand it back to Adrian to kind of close us out with ways that you can be involved.
Thank you, Alex. So lastly, what can you do to be involved and to help? The first and likely easiest way is to sign up for what we call Alert SF. That is San Francisco's emergency notification system. That is an opt-in system for text alerts or email alerts, or even you can sign up to also receive robocalls if you want, if you still have a home phone. The easiest way to do this is to text your zip code to 888-777. You just text that as the number and you put in your 5-digit zip code. And what that would do is that will subscribe you to alerts that are specific to your zip code. If there's a shelter-in-place order or an avoid the area order, or specifically things like it's going to be really, really hot and what can you do? Should you be staying inside during a poor air quality event? We send out emergency notifications to people who subscribe to Alert SF. Another great way to be involved is to educate yourself and then to share that knowledge. SF72.org is the best place to find emergency preparedness and planning information. And you can find that just on our overall website, SF72.org. We have what we call SF City Now, which is an interactive map, which is a graphic I had on an earlier slide that outlines during different events where you can go to get different resources. During a heavy rain event, where can you go to pick up sandbags? During a heat event, where can you go? Where are these weather relief centers where you can go and get cool? So SF72.org really is the best place to go for this type of emergency knowledge and to share that information with others. And then you can make your building, your faith building or other association a weather relief center or a shelter for your community as well as other vulnerable populations. Director Pappas mentioned our partnership during the Kincaid fire in 2019. We activated St. Mary's Cathedral as a shelter for those who were evacuated from fires in the North Bay. And so if you're interested in having your faith community involved, please contact me. My information is here on the slide to either become a weather relief center or other area of respite for the city. And then lastly, one thing that's not on this slide that I really wanted to highlight is that the Department of Emergency Management is working with the Interfaith Council and first responders to implement a disaster chaplaincy program. And this is a brand new program that we are working together to identify areas of faith relief and of areas where we can come together as cross-sector faith communities to grieve, to become restored and feel rejuvenated and help one another during and immediately following emergency incidents. So as this program gets off the ground, we can return to the Interfaith Council and provide additional information, but we're really interested in making this program very successful moving forward. And so last slide is just to thank you. Thank you for having us. Thank you for paying attention today. And thank you for your time. If you have any questions, please go through the Interfaith Council or feel free to contact any of us individually. Thank you very much.
Adrian, Tiffany, and Alex, it's we who thank you. Thank you for this comprehensive and informative presentation. As each of you alluded, one of the great hallmarks of San Francisco's success in responding to disaster and crisis are our cross-sector partnerships. Today, we have with us 3 panelists who are our partners in disaster preparedness. And each of them is going to take just a few moments to talk about their work, and then they're going to pose a question to you for response. So we'll begin with Allison Bittinger, who is the Disaster Program Manager for the American Red Cross Bay Area Chapter. Allison, the floor is yours.
Thank you, Michael. It's wonderful to be here. I'm honored to be joining you to talk about heat and poor air quality. For us, my name is Allison Bittinger. I'm the Disaster Program Manager in San Francisco with the American Red Cross. And for us, when there is poor air quality, it often means that we are responding and sheltering people. We'll respond as a region. Many of my team members in San Francisco will deploy out and go work in a shelter, help with logistics or whatever else is needed in a response. One of the things that we do when we are working a wildfire response is we'll ask people to stay indoors if the air quality is poor. We'll provide N95 masks and training to our staff and the clients who come in to use our shelters. And we also have disaster health services volunteers who can help triage some of the symptoms and either provide over-the-counter medications or refer to those with better, let me find the right words, refer to a higher level of care. As far as heat goes, as has been said already, heat is more dangerous and deadly than poor air quality. And so it is another important place that we like to plug in. While we do not run cooling centers, we might be able to support them. We may be able to provide staff or other snacks and water, things like that, and information. And we can do something similar with having our health services and mental health staff there in person to help out. The question that I have for this group is, I'm curious what lessons may have been learned in the last year with the heat and air quality during COVID, and what you might do differently if there is a resurgence of this COVID or another pandemic in the future.
I'm happy to start with the response to that. Hi, Allison. It's nice to see you. One of our strongest and most prominent lessons learned over the course of the pandemic has been our new relationship with different communities in San Francisco, and the importance of building resilience from within. And the adjustment from the cities, at least from the Department of Emergency Management side, assumption that we know what's best for various communities. And the change in mindset that has occurred for me and my director and our entire department has been really substantial. Just because of COVID and because of the way we've been interacting with people and learning from communities. And so if we were to do this all again, or things that have really helped us for possible future is that strong relationship with individual communities. And we've built up a real silver lining to this terrible pandemic has been our ability to make relationships that were previously not established between either the city or between community-based organizations and particularly vulnerable communities. And so what has been helpful is to adjust from what I just mentioned of the Weather Relief Center model and not just rely on that, but instead to really shift our focus over the next couple of years to outfitting and resourcing existing community centers or existing areas where people already go. We find that sometimes our weather relief centers are not often used to their full capacity. And some of the reason for that is because we are creating these locations throughout the city where people are unfamiliar with. They don't know the staff. They don't even know how to get there. They're unfamiliar with the physical space or the location. So instead of creating these locations, we're looking to really hybridize our model to also go into the places where people already go, whether it's an SRO or a community housing development or a community center or a senior center, and building up those relationships with the staff that we were able to establish through our COVID response, but retain those in a longer term and be able to utilize these places where people already go, they're already comfortable with, whether it's a church or a faith community or something of that nature. So that's why I mentioned a great way to get involved really is to contact me and to become a partner as a weather relief center, because the more we can help the communities that are already tied in to you, whether it's your parishioners or your otherwise, then we can help people. People can be less reliant on the city to open these larger centers if the places where they already are better outfitted and more resilient.
Great, thank you.
Michael, you may be on mute.
Thank you, Allison, for that wonderful question. And Adrian, I just wanted to say, if you could provide us with some information of what it would take to be a cooling station, we will help in getting that word out and trying to enlist congregations and other facilities owned by religious organizations to step up. But I think that that's one role we can play in partnering with you. In the spirit of time, I'd like to move on to Derek Gaskin, who is the Director of the Department of Safety and Security and Risk Management for the Archdiocese. Derek, are you still with us?
Yes, can you hear me, Michael?
We can hear you, thank you.
Okay, great, thank you. So, good morning, everyone. Thanks, Michael, again, good seeing you, and thanks to the entire San Francisco Interfaith team for giving me an opportunity to not only learn, but share with everyone that are participating today. Extremely nice to see our other partners at SFDM. I know it's been over a year plus, so my heart smiles and I can breathe a sigh of relief that you all are still staying the course as it relates to community outreach and support in regards to response. So my question, before I get into my question a little bit, so I've been tasked under the leadership of Archbishop Corleone with the Archdiocese of San Francisco, operates in 3 counties, with really overseeing not just the security, safety, risk management, but the disaster emergency preparedness. And part of that responsibility is making sure that, one, we serve as a partner to our communities that we operate in, but also we continue to develop and nurture our collaborative partnerships with all parties and all entities of interest. So I've been honored to do that, and it's been a privilege, and I will continue to rock out with all of our collaborative partners. So thanks again for the opportunity. So my question really piggybacks on one of the slides as it relates to health impacts. So outside of calling 911 and specifically when we open our cooling centers, so when the Archdiocese of San Francisco opens and really focuses on our cooling centers, how can we help accommodate the guests that take advantage of our cooling centers that may be taking specific medications in regards to their health conditions that could potentially increase other medical risk factors because of the heat-related conditions that increases both uncomfort, but also complications. And this is really about cold blue medical response. So again, outside of calling 911, I'm thinking maybe from a risk management standpoint, how do we communicate? How do we accommodate as it relates to, you know, a faith-based organization that opens a cooling center are now tasked with managing and mitigating that situation, which could escalate. Thoughts?
Thank you, Derek. I'll take that one. I'll start off at least. I think the best thing to do is to make sure that there's some kind of, if there are going to be staff that are going to be staffing these events, these weather relief centers, and that there is a kind of training beforehand. And this is something that we were able to do last year during the weather relief centers that we did open during COVID. We were able to provide training to the staff that were coming in so that they knew, you know, the COVID regulations. And in that same way, we could do something like that to make sure that people are aware of the different signs and symptoms, how to respond. Like I said, you know, for the more severe symptoms, the best thing to do is to call 911. And aside from that, it's really just about how to try to cool people off. And so just the staffing are aware of those techniques is I think the best way to go about doing that. In terms of like medications, I think it's important that, you know, when we provide messaging to people who might be coming to the weather relief centers, to make sure that they know to bring any medications that they may need while they're out of their house. You know, anything else that's medication wise, I would not want to put that burden of that knowledge or information on the lay staff. And so it would be a matter of making sure that there's communication with any physicians if there are any issues around medications with the guests' personal physicians, so that, you know, they get the proper advice. Did that answer your question, Derek? Or
Yes, thanks for the answer. Yes, training, I took away several things, but training definitely stood out. And I think that would be a proactive approach, which we welcome. And I hope everyone else welcomes. Thank you.
yeah, no problem. Thank you, Derek.
If I may echo what Derek just said, you know, Adrian, I think that as we begin enlisting congregations to be weather relief stations, to have what Tiffany described as these trainings, I think would really make congregation leaders and staff feel more comfortable in opening their doors and understanding what their responsibilities would be in opening these stations. So I just something to log in. Last but not least, we welcome Reverend Hans HAQR, the interfaith chaplain at the San Francisco Towers, a front porch community. Hans, you have as your congregants a very vulnerable population, which has become a sector that we know with the San Francisco Interfaith Council that our congregations are welcoming and making hubs for our aging adults. They feel valued, they feel safe, and these are really places where they're able to contribute as well. But they are vulnerable populations. How are you dealing with that over at the towers? Anything you can teach us, and then also, of course, please pose a question to our distinguished presenters.
Good morning, everyone. Thank you, Michael, for inviting me to be on. And I'd like to give a brief narrative of the towers and my role here. And first to thank Adrian, Tiffany, and Alex for your hard work and incorporating this information. It's been very, very helpful and will be helpful for our tower community going forward in participating in ways to help the greater San Francisco and then also receive assistance here at the towers. I'm a Lutheran pastor and have served at the San Francisco Towers for 2 years. We are a CCRC, a continuing care retirement community. We began in 1992. And some of those early founders who are called our pioneers are still around and active and vital. Our population includes independent living, assisted living, and skilled nursing. And we have approximately 275 residents here at the towers. We have worship services here at the towers to include Jewish community, Roman Catholic, and Protestant Episcopal communities. And our residents are also involved in a variety of places of worship in San Francisco, and we support all of them. A brief comment about the pandemic for us here, and a thank you to the San Francisco Department of Public Health. You were so helpful for us at the towers in the instructions and all the kinds of ways for us to mitigate the transmission of the virus. And with your help, we really were able to have maintain a lot of mitigation and protective procedures for us. Throughout the pandemic, all of us sheltered in place. We had good days and bad days. We were filled with hope early on, and then those hopes were dashed when we progressed, and then going back to another tier. We dealt with all of that. Separation from family and friends in our communities, senior communities, was very difficult. And the emotional toll now is being realized as we come up from the pandemic and open up. Pre-existing health concerns has been mentioned, and sensitivity to environmental change was about to be tested that day in June when the skies turned orange. Where were all of you is a question we'll ask each other through the years. Where was I when the smoke from the August fires, the August complex fires poured over San Francisco and turned our air, our sky orange? To the point of how we at the towers engage extreme heat and wildfires, our building circulates filtered air 24/7, which is a great gift to us and to our residents. We have exhaust fans, which keep fresh air flowing and have regulated HVAC units. We have a FEMA emergency care plan, emergency procedures that we follow to help give staff and residents directions and an organized effort to meet the challenges of extreme heat and poor air quality. So with that, I've asked a resident and a staff member for a question for you, the presenters today. In the event of extreme heat and rolling blackouts, I think is the issue. Rolling blackouts, what is the best response, could you say, to give to our residents who are no longer able to experience circulating air? And in this instance, we have potentially hundreds of residents. And then finally, some of our residents have caregivers, and they have beloved pets that serve as companions and sources of comfort and strength. And then my final question you've already asked, I know it's just to ask one, is ways in which our residents can get involved moving forward. And you've given that very clearly on the last slide. So that's all I want to say. Thank you for responding.
Absolutely. Thank you, Hans, very much. I'm happy to take the beginning portion of this question, and Tiffany and Alex can chime in if they like. I think in terms of extreme heat coupled with rolling blackouts, that's something we have been preparing for, been planning for with our PSPS, or Public Safety Power Shutoff planning. We did substantial planning for this in 2019, in the summer and fall of 2019, where we had a couple different workshops, one with the public sector, one with the private sector, and then one with the nonprofit sector, to talk through this exact scenario and go over the public safety power shutoffs and what would happen in San Francisco. Thankfully, what we've worked as we've worked through all these scenarios, we are finding it is more and more likely that our surrounding areas will experience public safety power shutoffs rather than San Francisco proper. And this is frankly due to the ways that the power generation and the power distribution lines are run for PG&E across the area. So it's not to say it's not going to happen, but what was a fortunate lesson learned from all of our planning with PG&E and our utility sectors is that it is less likely to occur in San Francisco. That does not mean we're not going to plan for it, though. So what we've been doing is we've been really focusing our heat and air quality resilience program on these three, what we call the trifecta. You know, we've talked about heat, we've talked about air quality, and blackouts is actually the third in this triangle of things that could all occur at the same time. So what the city has been doing is we are planning for investments in additional charging stations, generator power, and things that we can do to outfit specific communities, specific locations that house vulnerable communities, and then also ways to make it more congregate. So we could power some of our weather relief centers with some of these generators or solar powered equipment. So while COVID put a little bit of a pause on this planning for us, now that we've reopened as of this week, it's something that is top of our priority list to continue to be able to resource this equipment to be able to prepare for things exactly like you said.
Thank you very, very much. And thank you to all of you. The interchange and the presentations have been informative, comprehensive, and we will be sharing this information, this recording, widely with our 5,000 e-subscribers. Once again, we would encourage both all three of our presenters to engage the Interfaith Council in finding extreme weather cooling stations and the trainings necessary. We will continue to partner with you all in getting the messaging out, of course, on those days where vulnerable populations will be impacted. As we're saying thank you to our presenters and to our panelists, I also want to say a very special thank you today to SFIC Administrative Program Associate Cynthia Zambucas, who celebrates her birthday today. We are incredibly grateful for all of her efforts, and she has just been sort of really the backbone of our organization, and she's been a wonderful colleague to work with. Happy birthday, Cynthia, well deserved. Also, as we say thank you, we also say goodbye to our colleagues at the COVID Command Center's Joint Information Center Virtual Outreach Team. As I mentioned earlier, this will be the last program that we will produce in conjunction with the city, but because of the popularity of this program and the important content that has been conveyed, a private foundation funder has come forward, the Meta Fund, and is supporting the continuity of these programs. So we will continue on with these programs. I do want to say a very special thank you to Community Partners Group Coordinator John McKnight, who is also the treasurer of the San Francisco Interfaith Council Board of Directors, Trey Russell Allen, who is the coordinator of this programming, who will be picking up and helping us in the future with these programs. Elisa Carawala and Sharon Walton have been amazing at producing and leading these programs, as well as Hafisa Salabai and Nick Marino and all of those other members of the staff that have joined us. We thank you from the bottom of our hearts for all that you've done to make these programs and briefings the success that they have become. This is our 53rd. We also invite you to join us next week as we welcome some of our city's most prominent faith leaders for a conversation that will reflect back on the last year and a half's pandemic experience, lessons learned, and a vision for the new normal of religious life in San Francisco. So that is next week on the 24th at 8:30 a.m., same time, and we look forward to welcoming you all, and you'll be receiving information on this programming. That concludes today's program. Again, we thank you for being with us, and we thank all who made this program possible. God bless you and God keep you.